Hi, my name is Nicole.
My name is Zalia.
Hi everyone, I'm Louisa.
Okay, I know that Louisa really loves green tea.
I said Kopi Chats, yeah.
Is
It's
that
not
correct?
Hojicha. It's Earl Grey latte.
Guess mine.
Hot chocolate.
For Nicole's one,
You know she's
Yeah.
to the Christmas festives.
is it toffee nut latte?
Yeah.
Yay. So the first question is, what do people think you do at work? But what do you actually do? Sometimes I go onto taxis and then the taxi driver will ask my occupation and then they will try to ask me to read their minds. But I told them that they need to pay me first.
Yeah, and sometimes patients come in thinking that they will actually sit like horizontal on the chair. And they think that we all do hypnotherapy.
Right, like we might hypnotize them.
Hypnotize. No, I think that we actually do sit on chairs and we actually have the chairs arranged at 45 degrees.
Virtual reality actually brings about a lot of exciting possibilities, and in the healthcare context especially, it has been used in medical education, in surgery, theatres for training of surgeons. So, we wanted to think about how is it that we can harness the advantages of this technology for our patients with mild cognitive impairment. Share with us what is MCI and some of its symptoms.
MCI is actually mild cognitive impairment. It is an intermediate stage between normal aging and dementia, and these will include things like memory difficulties, slowing in the speed of thinking, poor attention, and other cognitive skills. So what we're trying to do is really to prevent further deterioration into dementia by doing things like cognitive training.
The prevalence of MCI in Singapore is about 12.5%. Yeah, and so I think that it's important for us to identify those at risk of MCI.
Why did you think of using VR for patients with MCI, and what are the benefits?
So this is actually the VR headset that we actually use.
So our patients come on a weekly basis to go through this cognitive training task, and they include tasks like memory training, attention training. What is your favorite memory through this project?
I noticed that some of them actually come in through the doors feeling very anxious because they haven't been in much contact with IT gadgets. Yeah, so I had this patient, she expressed a lot of insecurity about using this, and hands were all cold and everything. But I think through the face-to-face contact and interaction, I noticed that she actually managed to develop confidence. Okay, so if you were a Marvel Avenger, which character would you be?
I will be Professor X, because I will be able to read
Is that Marvel?
and control minds, and that will make my job a lot easier.
Oh. If I could be a Marvel Avenger, I would be Doctor Strange. He's just such a romantic person because even though he didn't just love her on Earth, but throughout all the multiverses, he still maintained his love for her.
If you liked our Kopi Chat series,
Follow us on Instagram.
And like us on Facebook.
Thanks
thanks for watching.